When you think about where you want to go for residency, when you think about what you need in a program, for me, it was very much about the community and the people around here. If you come to Middlesex Health for your family medicine residency, you will find a very supportive environment. Your co-residents, whether they're seniors or juniors, are your colleagues. Your faculty members are your colleagues, and they treat you as such. It's always warm, welcoming, and it's always a learning environment, a constructive environment.
Every resident over here has their own panel of patients, and that's a true panel that belongs to us. It is a lot of responsibility. In the end, it's something that adds to what I'm able to offer for the patients, but also allows me to learn even more, because when it's a patient that is my own patient that's going through something, I'm that much more invested, and as a result, I learn way more because I've put in that effort.
You are the physician, you are the doctor. The unopposed program is unique and special in that sort of sense. I don't have to compete for patients or experience or education. You get to really care for the patients and whatever it is that you really want to hone in on.
Here at Middlesex, we have these things called tracks of excellence, where you get to use the time that you get from this being a 4-year program as opposed to a 3 to learn about something that's really important to you specifically. You get a lot of freedom to decide what is it that makes you passionate about family medicine that we wouldn't get from a normal curriculum. Everybody is really committed to working with you and teaching you, and all the attendings, they're more often like your biggest sources of learning and also of like self-esteem building too when you're first here.
Middletown, it's a really, really great town because it has just a lot to offer, I think, for things to do, both to stay kind of connected culturally, musically, artistically, but also able to go outside, hike, bike, swim, run, whatever you enjoy doing. So it's the perfect kind of marriage of those two.
In Middletown, where we do have a little bit more of a city-like feel, it gives us that opportunity to meet those patient populations. But if you're interested, you can practice out in East Hampton, where there's a little more rural environment. And we do Connecticut Children's up in Hartford, which is definitely more of a city feel, and gives us the opportunity to experience the inpatient pediatrics world. So there's certainly the opportunity to see a lot of different settings.
I've been able to provide patient care in various different settings. I see my patients in the clinic, in the office. Right before that, I will be rounding in the hospital and then cap it off with a nursing home visit. And the fact that I get to see patients in different settings has really allowed me to learn so much more about the patient experience.
This residency program is like a second family. Everyone supports each other. We're always looking out for each other. Not only that, it's a part of a community, being a community-based hospital. So we really feel like we are involved actively in the community that we are practicing in and that we're helping. So we get that kind of unique opportunity to be a part of the community and foster those relationships.